for Tuesday, January the 27th.
Do I have wrinkles? So this machine will analyze your skin and give us a real data and compare you to about 300,000 women across North America.
Okay, Lindsay, please turn around. Let's see your beautiful face. Okay, so she's had a picture taken in the machine from the left side. Why from the left side?
So in North America, we'll take the picture from the left side because as we drive, the sun is hitting us from the left side, so that's where you get most of the sun damage.
Okay.
So if we were in Australia, we'd take the picture from the other side.
All right. Okay, so what are we seeing here with Lindsay?
So right here, this is going to analyze her skin across many different variabilities. So the first one we have here are just sort of brown spots. So you can see the machine is going to pick out these little tiny brown spots, and then it's going to give us an analysis of how Lindsay compares to women in her age group.
How does Lindsay compare to women in her age group?
So right now she's in the 50th percentile, so she's right on the borderline. So if you took all those 300,000 women, she's dead middle of brown spots for her age.
Does what your parents' skin look like have anything to do with what your skin is going to look like, or is it all just sun damage and what we've done to our own skin?
You know, really it's a combination of the two. So, you know, we are sort of a part of our parents' genes, but a lot of it is to do with what we do as an occupation, how much we drive, how much we're out in the sun, things like that. So if you know, in the old days, if you were working in a tannery and there was arsenic and stuff, you're really predisposed to skin cancers. So it's a bit of a variability between the two.
And have you had much sun exposure throughout your life?
I didn't think I did.
Surprise. But what can we do? How can we help?
So what we're doing here is this will tell us exactly, you know, how much bacteria and things are, and then we can decide exactly what to do. So one of the things we can do is do what's called an IPL, or what is otherwise known as an intense pulse light.
Okay, so that's what we're doing in here with another patient.
Right, so we have another patient in here with Anne as our medical esthetician. So the IPL is kind of, you think it's sort of like a laser, and what it does is it shoots a intense pulse light, a big beam of light that goes into the skin, and then we can control that light. That light will hit pigmentation, it'll hit blood vessels, it'll hit brown spots, and then it'll break up those blood vessels, break up those brown spots.
So you can reverse the damage.
We can reverse the damage. Now, IPL you need to do is a series. It's not a one-off. So sometimes you need 4, sometimes you need 6 treatments a few weeks apart.
Rice Cosmetic Surgery, that's where we are today. It's located at Leslie and Shepherd, and we are doing non-surgical procedures this morning. We're taking a break from Breakfast Television. We'll see you when we come back. I want to get that done.
Thank you so much. You're watching Breakfast Television. It's Tuesday morning. We'll be back with Jennifer at the Live Eye.
Good morning, everybody. Jen is showing us some fascinating stuff this morning about the latest in plastic cosmetic surgery, and right now she is sporting some cool shades, but something tells me it's not for the sun, Jen.
Okay, Dina, I'm going to ask you a personal question.
Let's go.
I don't know if you're going to admit it.
Oh, gosh.
Do you have a tattoo?
I don't. I don't have a tattoo. I was this close to getting a belly piercing once, but then I chickened out. You?
Oh, really?
Yeah.
No, I do not have a tattoo, but like some people get tattoos when they're young, you know, and they kind of regret it later on. Years pass, maybe the tattoo is stretching a little bit on different body parts, and you're thinking, why did I do that? And you want to get it removed. You can get it removed, and it's easy peasy.
Remember when Johnny Depp had Winona on his arm for Winona Ryder, and then they split, so he took out the na, and he just left wino?
I loved that. Perfect. Well, you got to do something, right?
Yeah.
Well, I'm going to introduce you to Dr. Sean Rice. Dina back at the station. We're wearing glasses. Why are we wearing shades this morning?
So we need shades to protect our eyes because this is a laser. There's a very, very slight risk that the laser can bounce off a metal object, catch you in the eye. So you just want to protect your eyes for safety reasons.
Lindsay has a tattoo and she wants it removed. Can we see your tattoo, Lindsay?
Yes, you can.
Where is it?
Right here on my hip.
Did you get part of it removed already, or is it just fading?
I did.
Okay, so what was it?
It was just 3 flowers on a vine.
And you thought, why did I do that? How old were you when you got that done?
I was 18.
18 years old.
I kind of chose it off the wall. It's meaningless.
Did you get it done with some girlfriends?
My sister.
Your sister, did she get one too?
Yes.
What did she get?
She got a butterfly.
I love it. Does she still have it?
No.
No. And you're in business. Lots of people want their tattoos removed. So how are we going to do this, and how many treatments is it going to take?
So we're going to use this new state-of-the-art called the PicoSure. So the PicoSure has been out about a year now, and it really is kind of the new sort of standard for tattoo removals. It's totally different than the older technology. The older technology basically generated some heat, so it was uncomfortable, and there was a risk of potentially burning the skin. With the new PicoSure now, it comes out so fast, it's like a shock wave. It comes out in a trillionth of a second, and that shoots an energy into there, and it smashes up the ink.
Let's see it in action. We have our glasses on for everybody at home. Do you have your glasses on? You don't need glasses. You're okay at home. Is it going to hurt?
It never bothers me.
Here we go.
Okay, it's just going to take 2 seconds to warm up.
Okay, while it takes 2 seconds to warm up, will it completely go away? You'll never know that a tattoo was there?
Well, you know, the funny thing with tattoos is it really depends on the quality of the tattoo that we started with. So if it was professionally done or amateur done, amateur tattoos take a lot longer to get rid of than professional tattoos, and the color as well. So if you've got multiple colors, then reds and greens can take some time to get rid of for sure.
Okay. So we're going to see this in action.
Sorry, it's just warming up. Because inside here there's a million mirrors, and it generates the energy to come out through those mirrors. So sometimes it takes a few seconds to get it kind of all booted up.
And all the time Lindsay's thinking, oh my God, but you had it done before. What did it feel like?
You can just feel a little bit of heat, but it's okay.
It's not that painful?
It's not.
So you don't need to take... There you go. And what treatment is this for you?
The fourth one.
The fourth one. Okay, and it's almost gone. There you go. We are removing tattoos this morning at Rice Cosmetic Surgery. It can be done now. And I'm still thinking of getting one. I'd get a 4-leaf clover if I got one.
Oh, no problem.
What would you guys get back at the station? I would. I'd get a 4-leaf clover.
Do you have any tattoos?
No.
What's that face all for?
That is just a little close. I'm sorry.
Good morning. We are back at Rice Cosmetic Surgery. I was just having a chat with Victor, and I'm like, have you had an injectable done before?
I have, yes.
You have, and I'm glad you're willing to be on breakfast television and talk about it. You look fantastic. How long have you been doing this?
About 5 years.
And why did you decide to do this?
I just noticed some sallowness in my face that needed help.
And now you look...
Better.
I don't know what you looked like before, but you look pretty good to me. But Dr. Rice, lots of men are getting this done now, not just women.
Yeah, becoming very popular for men. I'd say we're up to maybe about 30% of men now coming in for injectables, particularly around wedding season. So wedding season, the potential wife says, you know, you better look good for my wedding picture. So they come in, they get their, you know, their Botox and their fillers and things like that done. So.
Okay, I love this. And are you the only one that has this?
Yes, so we're the first surgeon in North America to use the vein viewer. So
what is it?
So the vein viewer is a way that we can find your veins. So let's say it started in the neonatal unit. It's very hard to sort of see your veins there. So now we can take this light and we can track your vein. So there's your vein coming down there. So I can actually even, block that off. Open it up and you can see your vein.
Let's do it on Victor's face, because the reason why we're doing this is because sometimes when you do an injectable, you don't want to hit the vein because there might be some bruising.
Yeah, so one of the biggest things that we find over the years is, particularly, let's say you got a wedding or something to go to, and you know, they're worried about getting bruised. So now we can use this vein viewer and you can see where all the veins are in Victor's face. Wow. So if we're doing, you know, a neurotoxin or Botox or Dysport, one of those, so we can actually put our injections around here and miss the vein, so significantly less chance of getting a bruise.
Okay, so what injectable are we doing on him today?
So the injectable that we've been using for Victor over the years is called Sculptra. So a lot of men like Sculptra because they don't want to have kind of come in here and all of a sudden walk out with big cheeks. They want a gradual
So this isn't freezing the face, this is filling the face.
This is filling the face.
Okay.
So Sculptra is what's called polyalactic acid. It's a synthetic component and it dissolves over the years. And what it does is it stimulates your collagen. So let's say you use things like Juvederm or Restylane, they're a filler. So you're going to put them in underneath your cheek and it's going to blow your cheek out. And as that filler resorbs, your cheek will come down. Sculptra is different. Sculptra will stimulate your own body to regrow its collagen, but it takes some time. So particularly for men, they don't want to walk in here, walk out with a big cheek. They have this done. You do it 3 treatments about 6 weeks apart, and then you get a nice gradual result. Nobody knows you ever had anything done.
Will you see the results right away?
No, it takes about 2 years. Oh, well, sorry, you will see the results about 6 months, but it'll last you about 2 years.
Okay, interesting. Okay, we're going to leave so you can get your treatment done because we don't want to see the injectable on TV.
Right.
So you get it done. We'll see you when we come back. We are at Rice Cosmetic Surgery this morning, Kev.
All right, thank you very much, Jennifer.
Rice Cosmetic Surgery, that's where we are this morning doing non-surgical procedures. Yes, you do get surgery here. You can get a tummy tuck, but we are doing non-surgical procedures and giving different women and men different options.
Right.
So what are we doing right now, Dr. Rice?
So right now we're using a radio frequency machine, and what that's going to do is it's going to help to tighten up the skin and melt the fat. So let's say you're afraid of surgery, but you got
and lots of people are.
Sure, a lot of, and totally understandable. And sometimes you work out like crazy at the gym, but you just get small little areas you can't get rid of, and sometimes surgery just may be overkill for that. We can use devices like this. So this is a radio frequency. So what it's doing is it's shooting a radio wave into the skin. That's going to melt the fat underneath, and it's going to help to tighten up the skin. So it generates heat. The heat destroys the fat, and the heat helps to tighten up the skin afterwards.
How many treatments?
So, you know, that's a good question, and it's very variable between patient to patient. I would say expect somewhere in the range of maybe 6 to 8 treatments, and you need to do that about maybe 2 to 3 weeks apart.
Rainey is doing this right now, and it's okay if you're still working out during those treatments?
Yeah, so let's say you want to go away for March break and you want to get to the beach and you're worried about a small little area, or it's even great for things like cellulite. So you want to do a temporary treatment for that. You want to look great in your bikini, but let's say your cellulite's going to come back from using a treatment like this somewhere down the road. With a maintenance program, you can keep that off.
Wonderful. Okay, we've got Antoinette, and Rainey is doing the procedure right now. Can we do it on the arms? Can we do it on other places on the body?
Sure, you can do it on any part of the body. You just can't do it on, say, the upper eyelids. You need to avoid kind of a really bony component, but you can certainly do it everywhere else.
Okay, earlier on, Antoinette had a facial procedure done. And what was the facial procedure?
Was the IPL, the intense pulse light.
But her skin looks absolutely beautiful. Does your skin always look beautiful like this? Or does this treatment, does it work right away?
It does.
It really does.
Yeah, you look absolutely gorgeous. Does this hurt?
No, not at all. It's actually quite relaxing.
Oh, it is? And how long does it take?
It takes about maybe 20 minutes, depending on how much of an area you want to do. And the nice thing with these, like the IPL and treatments like this, like you've seen Antoinette's face, and it wasn't that long ago that we did her treatment. Like she could go back to work, she can go to the gym, she can start working out, and nobody would even know you had something done.
You have great skin, period. She just has really good skin, too. Okay, I'm going to ask you to please move off the table so I can get on the table, and we'll see you when we come back for Rice Cosmetic Surgery this morning, doing non-surgical procedures. All right, Dr. Sean Rice, sounding good back at the station, by the way. Good stuff. We've got the glasses on again. We are here at Rice Cosmetic Surgery, but we are doing non-surgical treatments today.
Correct.
Of course, you do surgeries as well.
Sure, we're a level 3 facility, so we can do breast augmentation, tummy tucks, all across the board, you name it.
All right. We don't like to do that live on breakfast television, though. So we picked the non-surgical treatments this morning. We have Kathy on the table. Rainey is doing a treatment. What are we doing?
So this is the newest in laser facial resurfacing. It's called the Focus, and it's the similar tattoo that we use, the similar laser we use for tattoo removals. But now what we're doing is we're able to focus that beam on the skin. So it's non-ablative, which means it doesn't disrupt the upper layer of the skin. It shoots a shock wave through the upper layer of the skin into the lower layer, reorganizes the collagen, so you can get rid of things like acne, pitting, brown spots, melasma. It's a fantastic procedure.
The acne, I'm very interested in that. How old can you be? Because a lot of kids have it at a very young age. Can they get a procedure like this done?
They could get it done. You just have to make sure, in regards to acne pitting, that the acne is stabilized now, that you're over that sort of pustule stage.
Yeah.
And then it's into that little bit of the scarring one. And
so it's the scarring that we're taking care of.
We can get rid of, yeah.
Wonderful. So what about pockmarks?
Pockmarks, it works very well for as well. So, and the great thing is you can have this procedure done. You can go back to work right away. Your red face for a very short time period. I've had it done myself in between patients and gone to see the next patient patient, nobody even knew you had the procedure done.
Wow, that's kind of cool. Okay, so we're going to leave Kathy and Rainey doing this procedure. We're going to take the glasses off because we did talk about the fact that this is a surgery clinic. We're not going to show the surgeries, but I do want to talk about the breast augmentation because some women want to get this done, and they want to know what they're going to look like because it's a scary thing, you know.
For sure, yeah.
It's a big decision. So if they do, you can take what they look like initially. They might look like this in a bikini. You can also have the bikini removed. We won't do that on breakfast television. We're leaving the bikini on, but the bikini does come off on the screen.
Correct.
And you can go a little bit
So we can show you
bigger and then another larger and show what they look like laying down, sideways.
Exactly. A lot of times for women, you know, particularly for breast augmentation, they're very worried, am I going to look too big? Am I going to look too small? So this is the Vector. It's a 3D analysis system. So they stand in front of this machine here. 6 cameras fire instantaneously, and we can create a 3D image. So we can take your individual body, and then we can try on different things. Breast implants, you can try on sometimes what you look like with liposuction, things like that.
Okay, and you do it with no clothes on. I did not offer this morning to do this on breakfast television either. This is done, you know, when the cameras aren't
Sure,
here.
we'll do it later.
Yeah, we'll do it later. Thank you so much, Dr. Sean Royce. We're going to have all your information on breakfasttelevision.ca. Thanks for spending the morning with us.
Pleasure
We'll
being
see
here.
you guys tomorrow, everyone. Bye-bye. Thanks.